Welcome to Science, Health and Healing Encyclopedia of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is Children's Mental Health, What Can Parents Do? Part 14, Slow Breathing. Regardless of what diagnostic label any mental health professional might choose for your child, please know that your child is going to be under stress, have anxiety, have increased muscle tone, breathe faster, and have a quicker heart rate. Those are the simple biologic responses whenever a human being is being separated from his or her nature. It's that simple. Slow breathing is the easiest way to slow down the heart rate, get 5-7% more oxygen, cut down the tension in the muscles, cut down the acidity in the body, reduce the free radical activity in the body. And all what you have to do is to play a game with your child. Many years ago, in my book, The Cortical Monkey and Healing, I described how I taught an 18-month-old girl to control her asthma attacks with just limbic breathing. Now, what we did for this was we created a game of ring around a rosy. With this little girl, her one hand would be held by her older brother, the other by an older sister, and of course mother joined in. And when they would breathe in gently, normally they would gently raise their arms, and when they would breathe out slowly and very effortlessly, they would gently lower their hands. My whole idea was, how could I teach an 18-month-old child to breathe slowly? And it occurred to me at that time in a flash that if I could associate slow breathe out, which I'm interested, to give more time for oxygen in the air to get into the blood vessels in the lungs, because that's what slow breathe out does. If you have never been aware of how you breathe, the probability is that you have low-grade hyperventilation state. And slow breathing the easiest way. Did you know that it is difficult to remain angry if you're breathing slow? Put my words to a challenge. Next time you're angry, don't change anything except breathe out slow. Don't set goals, don't analyze yourself, don't ask any questions, just breathe out slow. Initially, you may want to breathe out, hold, breathe out, hold, breathe out, hold, and breathe in normally. Later on, counting is not necessary. Train yourself at home to breathe out slow and train your children to breathe out slow. This is the single best thing you can do for your child who has been labeled with a mental health issue, regardless of what the diagnostic term the health professional use. I'm not interested in that. This video is part of a large series, and the series title is Children's Mental Health, What Can the Parents Do? Please look at the introductory segment entitled Your Child's Mental Health, What Can You Do? I suggest a simple way of using this channel as a self-learning tool for yourself, and hopefully you can recruit your child also at least some of the time to sit with you and watch the material that I present. These are simple things. I use simple analogies, simple metaphors. I try not to bring any tedious scientific terms. However, for those viewers, parents who may want to really get a little deeper understanding of this, I would recommend my channel on this encyclopedia entitled Oxygen In, Acid Out. Oxygen In, Acid Out. So I suggest, as a part of this self-learning program, it is free of cost to you, of course. It is free of corporate deceptions, that you give yourself 6 weeks or 8 weeks and try to watch each segment They go for anywhere from 4 minutes to 7 minutes, twice. I am giving you my biologist view of what is called mental health. I'm giving you my views as a student of evolutionary design. Nature chose oxygen to drive all aspects of human difference and development, and there is no disease where the hand of oxygen cannot be seen, and there is no suffering where you cannot make some dent by providing some extra oxygen, and slow breathing is the best way. Please look at other segments, also another channel called slow breathing or limbic breathing. Thank you for joining me. We do offer, the corporation does offer for some fundraising purposes, my video seminar on limbic breathing. You can order that at majidali.com. Thank you for joining me. Thank you so much.